So my name is Sarah Reed. I'm an Improvement Fellow at the Health Foundation. In this session at HFMA Annual Conference, we were exploring how NHS organizations can have this broader role in place, what it would take to maximize their full potential as powerful economic agents in their local communities, what it means to be an anchor institution, and where some of the greatest opportunities are for taking that further. So anchor institutions are large public institutions that are rooted in place, so they're unlikely to leave for any reason. And with them, they carry large assets and resources that can be leveraged and channeled in different ways to improve the health and well-being of the populations where they're based. So the NHS is an anchor institution for lots of reasons. For one, it's a large employer, the largest one in Europe and the largest one in lots of local populations, making it a really key source of economic opportunity for the communities where it's based. It also is a big spender. It spends about £30 billion a year on goods and services, and that's just hospitals alone in England. So can be leveraging its purchasing power in different ways to support the communities where it's in. It's also an owner of lots of capital, buildings, lands, and property that can be used in different ways to support communities, either by creating different assets like affordable housing or green spaces that all have an important impact on health. And that's just only some of the ways that the NHS has a much broader influence in populations beyond the treatment and care that it provides. So the wider determinants of health are so important for NHS organizations to be considering because so much of what makes us healthy comes from outside of health care. Some estimates suggest that healthcare accounts for as little as 10 to 20% of our overall health outcomes. So when we're thinking about how can we really improve the health and well-being of people living in the UK, we've got to be thinking much bigger and broader beyond the boundaries of service delivery. And the NHS, as an anchor institution, given its broad economic and social influence it has in a place, can be really making a profound difference to those wider determinants of health to help prevent illness and the onset of disease in the first place. Yeah, I think a key takeaway from this session was that there's a real potential here to be aligning kind of what we call the back office functions of the health and care system with frontline delivery. So putting health in all of our policies and practices in a core part of the way the NHS operates. So there's a way to be improving health through the way the NHS hires, the way that it purchases and spends money, the way that it uses its capital assets, the way it impacts the environment that we're all in, the way it works as a partner in a place. There's a real potential here for the NHS to be leveraging all its potential for health and well-being. The NHS can make a bigger difference in the places where it's based as an anchor institution in lots of ways, but I think thinking about its opportunities as an employer, so how can it be widening access to employment for the people who could benefit the most from an NHS career, how it can treat and look after the 1.6 million people who work for it to maximizing their health and well-being, what it chooses to purchase and how can have an important impact on health through the way it approaches procurement and considers social value as part of those spending decisions, the way it opens up and uses its capital, its buildings, its land for community benefit through the form of affordable housing or green spaces, the way it reduces its carbon footprint, given that it contributes about 40% of the public sector's overall carbon footprint, what it can do to be reducing that, to be improving health and well-being. So loads of potential here. This is just the start of the conversation. The term anchor institutions is something that has been around for a while. The NHS hasn't invented it, but it's so exciting to see such enthusiasm here at HFMA for the potential for this, and just really excited to be working with finance directors and the NHS finance community about taking this further.